Okay, so welcome everyone who's on Zoom, everyone who's on Facebook. Big welcome. I know we usually have these sessions, or we've got loads of sessions this week. We've got the anti-cancer sessions, we've got the community circle, so we've got lots of sessions this week. I know this is usually on a Wednesday, but we wanted to get Cantourage on because what they are, here we go, hang on. What they're doing is really unique, it's really needed, it's fundamentally important, and they're paving the way in terms of the way medicinal cannabis is being used and perceived in the UK, and that's fundamental. It's needed. It was urgent, in my opinion. So, and I know over the months we have loads of messages from you guys asking for help around obviously different reasons, and most of the time, medical cannabis would be something that would be clinically indicated. So based around that and based around the kind of demand for that kind of information, I thought it'd be brilliant to get the guys from Cantourage, who are the experts on this area, here to talk to us. I've got some questions I want to ask them, and then you guys can ask any questions that you want. But I think it's really important to demystify this and to let everyone know how evidence-based and how accessible cannabis is. And how we access it, what the process is, how Cantourage work. Okay. So Gabriel, do you want to introduce yourself and just, I know obviously we've spoken before and whatnot, but what I'd love to hear from you guys, because I think it's a very powerful story to kick us off, is, what was the motivation? What was your motivation for getting Cantourage off the ground and growing it so quickly and kind of creating this movement? Because I think it's, I think what you've done is testament to the value you see in it. So kick us off. What's the story?
Sure. Thanks very much for the lovely introduction, Sam, and hello everyone. I'm Gabriel. I'm the UK CEO of Cantourage. So Cantourage is a business. We are a pan-European pharmaceutical manufacturer that specializes in medical cannabis. So in the UK, since 2018, medical cannabis has been legalized for medicinal purposes. Which for us is something that as a message that we're trying to drum home all the time. But, I think we always, ask the question, if we were to go around the street and ask people if they were aware if medical cannabis was available in the UK, 9 times out of 10, and in fact it goes as far to say as 99 times out of 100, most people go, I had no idea that was accessible. So for us, it was something that we really kind of want to try and break the mold in that regard. We're definitely not the first medical cannabis provider here in the UK. But we'd always like to kind of try and lead the charge and making it accessible for patients. So in April of last year, we launched Cantourage Clinic, which is a direct-to-patient services medical cannabis specialized clinic. So what we do is we ensure that patients, regardless of their condition, as long as it's eligible, we do the necessary checks here in the UK, and we introduce them to doctors such as Dr. Gerard Sinovich, who I'm sure will do an introduction very, very shortly. But I think for us, and why I was so keen to jump on this call was my real motivation. In 2018, my brother was actually diagnosed with a Ewing sarcoma. So he had a tumor growing out of his scapula. I was already loosely involved in the cannabis industry at that time. My business partner and I, we set up a functional CBD beverage. And I know, Sam, we've touched on this in the past. We were just trying to find ways that we could kind of break the stigma for cannabis. And in 2018, there was a real shift. I'm sure you would have seen that CBD products began popping up everywhere on shelves, and people were starting to understand that cannabis wasn't just this horrible gateway drug, that it was something that could have medicinal purposes. And can certainly improve the quality of life for people suffering with many different conditions. But for us, when we were already involved in the cannabis industry, and my brother was diagnosed, we actually worked from the ward whilst he was going through his treatment. So he'd do a week on in the hospital, and then a week at home to recover. And throughout that whole journey, it was, for us, we were always looking at ways that we could try and better his quality of life. And obviously it was really tough for us to see him from being a vibrant young man to being a patient going through chemotherapy. And we're all aware of what that does and how that can affect people. Of course, people going through the treatment themselves, but everyone around them as well. So was actually a really bizarre situation where my partner and I, Josh, were sitting in the ward and we were strategizing about how we could get this CBD functional beverage into every single shop around the country. And someone leaned over and asked the question and said, "Are you guys talking about cannabis?" And we kind of looked a bit shocked. We thought, do we say yes? Do we say no? But we decided to say, yeah, we absolutely are. And we told him a little bit about what we do. And turns out his son was also suffering from a Ewing sarcoma. And, he mentioned that he himself had gone through testicular cancer just over a decade ago. And that he counteracted the kind of the impact onto his life by consuming THC. And, is this something that we would be interested in? And to be honest with you, at that time, obviously you're always kind of thinking, I come from a family of dentists and GPs, and they were always very, very against kind of any kind of alternative treatment therapies. And you have to listen to what the doctors are saying and, make sure that, you follow everything by the book. But at that point, I think you kind of process things in different ways, and you think, well, at the end of the day, what's most important? Is it, making sure that, he has the best and gets the most out of his days, or, or is it something that, you just lay it in the hands? And rightly or wrongly, we decided that absolutely we'd like to give it a go. I think, in those moments, you make a decision, you stick with it. And so
but from, that's what's frustrating, isn't it? Because, and people are still having that inner dialogue of, is it right? Is it wrong? But if you actually dig down to the clinical research, actually answers itself. I'm not saying in every clinical cohort, but in the majority of cohorts. I know some stronger than others, but the rationale for, do I use this or not? The evidence is there to say do it because of X, Y, and Z. So I think back then it must have been harder, and hopefully it is now. But it's so needed, isn't it?
No, absolutely. And I think for us, it was just, at the end of the day, when you kind of see the color of the liquids that were going through his body, I mean, a brown natural, substance that grows out of the ground, that's been used for thousands of years in a variety of different ways. It couldn't possibly be any worse than what was being, put into his system via IV, for 24 hours a day whilst he was spending his stints in the ward. So, we took the leap for it. And one thing I could say is, how could we introduce it into kind of his treatment routine? And, on top of the other pills, he was taking pills to reduce the nausea. Then he was taking another pill to kind of boost appetite. And it just all seemed, that if we were to add another natural substance into that daily routine, what's the worst that can happen? One thing I can categorically say is, regardless on the evidence of what it does on THC being able to kill cancer cells, one thing that is undeniable is his mood and his appetite, and everything peaked. There's something to say that, I really wouldn't want to comment on the science on THC and killing cancer cells. And I know there are some studies out there that do suggest that, but I think for us, in a lot of those situations, it's mind over matter. And if you can put yourself into a situation where your mind is in the best possible way, and whatever you can do to kind of boost your energy and put you into a situation where kind of gives you that kind of gung-ho attitude, I think, as always, anything that can lift you throughout that cycle is absolutely vital.
And you said you noticed a discernible difference, as an observer. How quickly did that kick in from starting the cannabis treatments?
It was pretty much instantly, to be honest, because he was really, really struggling to eat. And, there are direct correlations to THC boosting appetite. And that was just undeniable. I'll never forget when he was at home during that week. Obviously, we couldn't give it to him whilst he was on the ward, but when he was home, he'd be sitting on the sofa and we'd be laughing and eating and eating junk food. But, at that time, any food is better than anything at that point. And it was good to have some quality time with him and see him laughing and smiling, because obviously when he was in the hospital, it was hard to keep him smiling. Obviously, no one wants to be in the hospital for long periods of time. And it was a long treatment journey. He had his bouts of chemotherapy, 14 bouts of chemotherapy, and then he actually had a trial therapy at the time, which is proton beam therapy. So they were using proton beams at molecular level to kill the cancer cells. And throughout that whole journey, it's really strange. I mean, I say strange, but we always knew deep down what the reason were. But whenever we're taken back to the hospital, that, you know, the nurses would always look at his blood counts and they'd see his hemoglobin levels was up, white blood cells were up, platelets were up. So
Wow.
you know, we were sitting there just going, you know, and they were always like, we don't know what, you know, what are you doing whilst you're at home? And, you know, we weren't telling anyone, but it was just a real crazy thing. And to be honest, the only reason I kick myself is that we just didn't record it like, you know, week by week, because that would have been such powerful data that we could have collected. And out of the whole thing, obviously, it completely changed my life, changed people around me's lives about, you know, kind of our perception of cannabis. But yeah, one thing I really do wish that we just recorded it all properly, repurposed it, because
I think anyone working in, you know, who's worked with or helped someone who's gone through any, I've seen it with Parkinson's disease, I've seen it with cancer. I think the story, the dialogue is pretty much the same as what you've said, different story, different back history, but generally the same picture. And going to bring in, welcome, Dr. Sinovich. Great to have you here. Thank you so much for finding the time to be here. Can you just give us a little bit of background? I know you're, am I right in thinking that you are a consultant in the NHS and also a pain specialist? Is that right?
Sam, how are you doing? Can you hear me clearly?
Yes, thank you.
Excellent. So hello viewers. My name is Dr. Gerard Sinovich, and just a brief background. So I've been an NHS pain consultant for about 8 years, specialized in non-cancer and cancer pain. I got into the cannabis industry around about 4 years ago in 2018 when it started to get legalized, because I was looking for alternative methods for some of my patients, because you can only get to so far with conventional methods, because we're all completely different. We respond to different type of treatment. And I was looking something for the next level, and that's how I got into the cannabis industry. And I've never looked back. Let's put it that way. Over the last 4 years, I've been prescribing. I've seen over about 5,000 to 10,000 patients, prescribing various oils and flowers. And it's just really nice seeing the pathway that all these individuals undergo, because we closely follow them up with how it's improved their sleep, their lifestyle. A lot of people have come off opiates. A lot of cancer patients have done really well in terms of helping their symptoms, improving the quality of life that they have with their family. So it's always something good to give back to the community, just to basically see how you change a person's lifestyle, their family dynamics. So I must say it's been quite a revolution. Look, cannabis has been around since 3000 BC. So we have these endocannabinoid receptors within our own body. All we're doing is we're just activating them, and we're really basically just substituting the opiates, which was always the mainstay of treatment for cancer pain, with cannabis, because we know where does cannabis fit into the cancer conversation. Look, there are a lot of high quality studies that still need to be done. Cannabis really has shown to benefit people battling with cancer in really two ways, in terms of helping with pain management, helping the side effects of chemotherapy, which Gabriel alluded to. And also there is some studies ongoing for even basically try and prevent and treating of cancer. But again, that's still very, very early stages. So really, cannabis only really comes into the form of helping with pain management, and also helping easing the side effects of chemotherapy itself. And look, over the last couple of years, the survival rates have markedly gone up. Women do a lot better than men, but if you look at from 1972 until where we are now, the survival rates are going up. So there's a lot more complications ensuing from treatment, and that's where cannabis comes in.
Yeah, and I think it's, I mean, it's interesting, isn't it? Because again, then you start fanning that research out into other pathologies and other areas. I mean, there's been some their case studies, so they're not as methodologically robust, but around the field of Alzheimer's and dementia. Some very, very profound outcomes in terms of functional quality of life, memory recall, psychometric agility after using cannabis treatments. And I know the Bredesen protocols, the most advanced Alzheimer's protocols in America, are now heavily leaning into the cannabis treatments. So it spans so many areas, isn't it? It's not just kind of the cancer arena. And I mean, I know it's a huge question. In many ways, it's a stupid question, but can you briefly just describe to us the main mechanisms by which cannabis is working in our physiology to impart these kinds of gains? What's the kind of the takeaway message here with why it's so effective, why this evidence is stacking up?
Well, the evidence is slowly stacking up, because if you have a look at a cannabis plant, there's roughly about 120 different phytocannabinoids. And the two that we know very well is the CBD and the THC. Now, We know that these two molecules act within the endocannabinoid receptors, which we have within our body. These are what we call the CB1 receptors and basically the CB2 receptors. Not getting too technical, but the CB1 receptors are in the nervous system, the connective tissues, and the CB2 are mainly in the immune system. And what the cannabis does is it mimics the actions that happen at the CB1 and CB2 receptors, where your THC is a partial agonist at the CB1 receptors, and your CBD is a little more complicated itself. But if you have a look at the effects that it causes, we know that basically CBD has a very good anxiolytic properties, has a good anti-inflammatory properties. It helps with sleep, pain, and mood, but not as much as the THC element. THC is very good for pain relief. It increases your appetite. It decreases intestinal motility, as well as the main effect, which is the analgesia. But that's the one that has potential side effects. And the side effects that you can get from THC is what I term the 3Ds: a bit of dizziness, drowsiness, dry mouth. Very occasionally, you can get a headache or double vision, and very occasionally can increase your heart rate or drop your blood pressure. Again, highly unlikely. All right. When you normally come to a clinic, particularly Cantourage, we start you on small amounts, slowly build it up within the system, monitor you continuously. And normally we combine CBD with THC, because the nice thing about CBD, you get the effect, as I mentioned before, but it also counteracts the side effects of THC. So you're able to improve your pain element, you're able to improve basically your appetite, and also you're able to improve your nausea, and therefore improving your treatment in terms of cancer. But it doesn't only stick with cancer. As we know, cancer pain is a very complicated pain itself from multiple factors. So that's a little brief element of how potentially cannabis can help.
And is that, so can we then extrapolate those mechanisms? So someone who's listening here and they've got arthritis, they've got fibromyalgia, can we extrapolate those mechanisms across to those systems in the body relevant to those ailments?
Correct. Because as I said, your CB1, CB2 receptors are widely distributed, and that's where the cannabis acts. It's not like the morphine receptors, which are very concentrated in certain systems of the body. This is acting widespread. So it's going to help your pain, it's going to help your sleep, and it's going to help your mood. And those are all factors that come into this talk in terms of cancer, but it's not only limited to cancer patients. I have loads of patients that have multiple surgeries on backs, on necks, those patients that with fibromyalgia. I've done a lot of patients with Crohn's, ulcerative colitis disease that we have on medicinal cannabis. I've done loads of talks in terms of gut motility and how we can improve it from that point. So the uses are endless. It's not for everyone, let's put it that way. But as I said, that's the reason why you get a trial when you come to a clinic of medicinal cannabis to see if it's going to help you or not.
I'm just going to digress quickly from the questions that I want to ask, because I know there's a lot of people. We've got about 400 people in this membership, and there's quite a high percentage of those people suffer from inflammatory bowel disease, particularly diverticulitis. And like you just mentioned that, then is that because is that in terms of preventing flare-up prevalence? Is that in terms of treating during flare-ups? Is it everything?
It's everything, because remember, you have what we call a gut-brain axis. Okay? So it helps with modulation of that gut-brain axis. It's probably not a simple talk we can do in 5 minutes, but it's primary about it's helping with all its symptoms itself, improving. Most of the time, most of the patients get off the medications. It's improving basically them getting out and about, because a lot of these people just feel embarrassed to go out because they're worried what's going to happen from that point of view. It's improving their appetite. So it's a multiple factors, but yes, as I said, it improves multiple aspects, and not only really just treating it, but also augmenting the current treatment that they're on as well.
Okay, so that's everyone listening to this, whether you're listening live now on Facebook or as a recording, that's something that I know we've got a lot of questions around inflammatory bowel disease. That could be something that is, game changing if you're suffering. So that brings us on to, are you microdosing at Cantourage? So say if someone comes to you and I've got diverticulitis, I've got, surgical pain, whatever. How does the process work in terms of how you prescribe, the dosing you prescribe, how it's individualized? How does it work?
So when you come to us, obviously you meet our lovely team, and they'll take you through the induction process of how you get onboarded within the clinic. Once you onboarded and you've had an assessment with one of the nurses, just to make sure that you meet all the criteria, you'll go through to a specialist itself. Normally what will happen is that you will have a specialty appointment We'll go through your medical records. We'll make sure everything is correct. We'll look at what past treatment that you've been on to make sure that you fit medicinal cannabis. You'll then go into the potential benefit side effect profile. You'll then look at the different preparations that are available. But in essence, there are 4 different preparations that you can get cannabis in. It either comes in an oil, it comes in a flower, it comes in a vape cartridge, or it comes in a capsule. Okay, so there's 4 routes that you can administer itself. Now, the oils itself, they're quite lipophilic. Normally, I suggest having it with food because it's increased absorption when you do have it with food. The oils take around about 1 to 2 hours to work, but do give you around about 6 to 12 hours of good pain relief. On the other end, the second one you have is your flower. Now, your flower itself is very quick on onset, works within around about 1 to 2 hours. You need to administer it via medical vaporizer. And the reason for that is because the cannabis plant is quite temperature sensitive. So when you smoke or joint, what happens is that the temperature is too high, so the flower goes instant combustion. You lose about 6% of the value of the flower, plus it plus you generate carcinogenic products. So when you put it through a medical vaporizer, you control the temperature at which the flower decarboxylates. And that's roughly about 180 to 250 degrees, because at that optimal temperature, you're going to get release of the active terpenes, the flavonoid, the CBD, and the THC. And all those components are going to give you what we call an entourage effect, where it's going to help you pain, your sleep, and your mood. You also have vape cartridges. Now, vape cartridges, they are new to the market. They are come out from California. The vape cartridge itself a little bit more expensive, but they allow for easier usage. They're similar to the flower. They work within 1 to 2 hours. You don't need a medical vaporizer to put it through. They're a little bit more discreet. I have a lot of patients that are going into the city that use these vape cartridges that help with their pain when they really need it, because it acts quite quickly. And the last route is the capsules. Now, the capsules is something, again, very new to the market. So again, they come in different formulations. However, when you come to us, and it's the first time you've never used cannabis before, the best route to go is the oil route. And the reason for that is, number one, it's easy to administer, minimal cost, and you're also able to then titrate the dose. Because we have to titrate the dose very slowly, there's no point coming to us, starting a medication, get massive side effects, never use it again. You've lost the whole window of that opportunity. We can always introduce flowers, and we monitor you very carefully, look at how it's affecting your daily life. Are you getting breakthrough pain? Do we need to go up on the dosing regime? And again, oils, flowers come in different concentration in terms of CBD to THC ratios. It's about playing around with it. It's at the end of the day, it's a bit of a tailor-made treatment plan to each individual that comes to the clinic. And it's about finding the right dose work for you. It's not necessarily going to work well for someone else.
Okay, so it's very not trial and error in a haphazard way, but it's very much trying it, seeing what's working. Okay,
correct.
I've got a good question here. Actually, which was on my list of questions. So someone who's watching on Facebook. Hi Gerard, my consultant went from steroid injections to nerve ablation to telling me that opioid patches are my only option for chronic back pain. Any advice for how to approach a consultant and ask for something different when they have been very clear that there are no other options available that would work?
Look, it all comes down to education. Look, I can't comment on the consultant that they're visiting, but there are always options in life, all right? That's the reason why you come to different. Look, I'm a consultant in pain management. I agree with what he says in terms of these different treatments. Again, he's given the options what he's aware of. All right, does not necessarily mean what the only options that are available out there. If you've never used cannabis, look, cannabis is something new. 4 years ago, I knew nothing about cannabis. If you speak to 90% of the GPs now, they still know nothing about cannabis. Unfortunately, it comes around education. They are improving the education around cannabis. They are starting to introduce the endocannabinoid receptor in medical school in terms of teaching upcoming doctors about this other system that is available. Look, it comes down education and what works well for you. When we start treatment, we always liaise with any of the consultants that you are under to say that you are starting medicinal cannabis. If they do have any questions, they can come back and ask us. Look, we never try and undermine any consultant. We always try and work with your consultant or doctor that's referred you, or whether you want to come for treatment. And again, with cancer treatment as well, we work a lot with the palliative care team. We liaise with them exactly what we're doing. So we're never interfering with treatment. We're trying to augment treatment. We're trying to augment the recovery process. We're trying to augment your improvement in your pain, your sleep, and your mood. And we're trying to improve your quality of life, which comes down at the end of the day.
And to my mind, it's the very best model, isn't it? Where you've got an approach where it allows someone to take the very best of evidence-based allopathic medicine, but at the same time, really enhancing and supporting that with integrated care. And I think it's interesting in the NHS framework, isn't it, where we're seeing this slow but definite progressiveness into opening eyes around herbal medicines, or whatever way you cut it. cannabis is a herbal medicine. And I know there are trials around angiographies for urinary infections and things like that, but I feel like it's definitely gaining momentum. And I think this ability for people offering private care, such as Cantourage in cannabis, and the ability to liaise with NHS care to make sure the patient's getting the best care is amazing. So for Lisa, who's asked that, for something like chronic back pain, based on everything you've said, you'd imagine that cannabis treatments would offer real efficacy and real impact.
Look, I get a lot of patients that have 3 or 4 surgeries that come and see me. Even I have seen patients in a chronic pain clinic where I feel I can't do anything for them anymore, and give them the option of medicinal cannabis. At the end of the day, it's a patient's choice or what type of treatment that they want to go. We know it basically works, and that's the reason why it's not going to work for everyone. That's the reason you get a trial basis to see if it works. And if it does work, the results are quite remarkable itself. And normally you see a marked improvement in 60 to 70% of individuals. So it depends on finding that right combination. As I said, looking at the efficacy of cannabis, as I said, comes in the 2 forms, exactly like opiates. Opiate comes in 2 forms. Opiate comes in a long-term preparation, which is similar to the oils, and it comes in immediate preparation, which is similar to the flower or the vape cartridges. So again, they have the same mechanism of action. If you look at the endocannabinoid receptor, endocannabinoid system, and your opiate pathway, they run together. All right. So they work exactly in the same system within the body itself. That both systems have been around for the last 3,000 years. All right? And it's only recently, over the last 20 years, that we've divulged into finding the CB1, CB2 receptors that we never really knew of. So
this is amazing, isn't it?
It is. It's research, and that's what research does. Research brings new options, new treatment trials to see what works, what isn't working itself. But we've all have it within our system. It's endogenous within ourselves. So why not activate a system that we already have within our body? These endocannabinoids are floating around within our body. All the cannabis is doing is just activating these receptors and acting as a synthetic, not a synthetic, should I say, a natural herbal, imitating the effect that it would have if it was in your system in amounts.
What a beautiful model! Like, what an intuitive and commonsensical way of managing problems. It makes so much sense. And Sari is asking a question: how addictive can it be, or does it vary from oil to flower to vaping? Any issues there?
Yeah, so if you look at the addiction potential of cannabis, now cannabis is a model which has very safety efficacy profile. So if you look at cannabis, it's probably as addictive as caffeine is. All right. So it's not addictive whatsoever if you're comparing that to opioids. Number one, the lethal dose, as well as basically the dependency level, is very, very low. All right. Compared to opiates, you're very prone to get what we call tolerance. So what happens is that you have to have more in order to gain the same effect. That doesn't really happen in cannabis itself. All right. So with cannabis itself, you can switch between different ratios in terms of THC, but you never become dependent on it. You can stop it at any stage that you want. And remember, we're doing it in a medical grade fashion. So we are titrating your dose accordingly. This is not recreational. We're not aiming to get high. That's the whole point of this treatment. This treatment it's a medication at the end of the day, and it gets treated as a medication at the day. But if you look at the comparison rate between opiates and cannabis, you can't even compare them. All right. Cannabis is right at the bottom of the scale, and opiates is right at the top in terms of its dependency and lethal dose.
Okay, so that's Sarah, does that make sense? Happy with that? I think that's a very good way of articulating it in terms of the caffeine kind of equivalent. So another one, are patches.
It would just be a quick comparison. So there's a study that came out of the United States in 2018. Look at the cannabis-related deaths and look at opiate-related deaths. The amount of cannabis-related deaths was 0. The amount of opiate-related deaths was 50,000. So
wow,
and this is 2018 when it's all started to come in with the literature itself. So that's the comparison that you're looking between the two.
Okay, so that's very clear. Kate's asked, are patches in the pipeline, or is it the wrong modality to treat in terms of using
with patches? I'm sure there will be in the pipeline, like with anything. The problem with patches is that it's got a very variable dose. So in terms of absorption, it can be a little bit hit and miss. There are CBD patches that are available that you can use. But again, the literature in terms of efficacy and in terms of how much is absorbed and how much is working is, again, debatable. And there's still a lot of literature research that needs to be done around from that. In terms of THC patches, I think that you would have to come to a clinic for. There aren't any THC patches that I'm aware of that are high enough dosage there itself. So again, I don't think you'll get as much benefit from patches. as you would from other treatment modularities itself.
Okay, that makes sense. And this is a very pragmatic, very interesting question. So in the UK, is there a requirement to carry paperwork for use, and in particular if traveling via a flight? Are there any issues with the legalities of having this?
What I'm going to do is, yes, there is, but I want to give you over to Gabriel.
Yeah, I was going to say.
He's itching to answer that question in the background. So I'm going to give it to Gabriel to answer that, because I don't...
Right, over to you, Gabriel.
Not at all. I love hearing you speak, Gerard. That's why we've got you, sir. No, but
that's a big question, I know, isn't it? It's probably a massive question we'll just ask there.
The patches one was really interesting. Just to kind of, just to touch on that, we are always looking at alternative methods for treatment. I think the most thing is to always try and find a method that people are comfortable with, and particularly if you're cannabis naive, we understand that the idea of vaporizing cannabis could be something that's maybe a little bit too far out of your comfort zone. So we're always looking at different ways. I think the key thing is the guidelines that we have to go through to launch these products. A lot of the time, in order to kind of manufacture those products, you really want to make sure that there are the relevant efficacy trials that come out of them, and no one's yet sort of excelled on that point. But onto the paperwork piece, it's a very good question. I would say pretty much on a daily basis, we get contacted by patients to write them travel letters. So it's a really key thing. We always want to make sure that whilst patients are traveling, that they still have access to their medication. Continuity of care is a massive factor, and we always want to make sure that regardless of the location, that if the embassy does accept it, then of course you can travel through borders with a letter from the clinic themselves stating that you are a medical cannabis patient. Here's a copy of the prescription. Here's an indication from Dr. Sinovich, or if it's another specialist, that I confirm that I have prescribed this amount of medication. So it's totally acceptable to travel across borders should the location accept it. And generally, we do also get contacted. Again, it comes down to awareness. Unfortunately, a lot of the police force aren't entirely aware that medical cannabis is a viable treatment option here in the UK. So we often might have to just present, again, different levels of justification for them carrying the medication themselves. But again, it's really key to make sure that you are consuming it in the correct manner. It is still illegal to smoke medical cannabis here in the UK because it's not prescribed as per the doctor. So again, it's just making sure that people are always staying within their treatment plan and they're using the cannabis as advised. So it's a key element there.
So there is a very clear process. So if you're on medical cannabis, it's been prescribed through a clinic, and you want to travel to Australia, America, or wherever, there's a very clear process how you do that, and you can still continue care and treatment. Okay, correct. So that's pretty. And this is a good question. So Leanne just put too many questions. So that's what actually on my list. So pragmatically, so yeah, you're at home, you've got an ailment, you've got cancer, someone you're caring for has, and you think, okay, this sounds really promising. What's the process from that decision to starting treatment? How does it work? So that they contact you guys, then what? What's the journey?
So we would, once we receive contact from the patient, we'd just ask them to fill out a very simple eligibility form. And I think for us, as soon as we see that there's cancer listed on the medical record, we know that immediately that they would be eligible under cancer-related pain. So there's no concerns there, as long as we can cross-reference what's been stated on the initial application with a copy of the medical records. We can get them in touch. We can get in touch with if it GP practice if we need to, or any of the relevant medical teams on the other side. But as long as our clinical team can cross-reference, there's no concerns, and would get you booked into a consultation with Dr. Sinovich as soon as possible. And
is that in person or in line, or how does that work?
Sorry, Sam, what was the question?
Is that consultation? So once they're eligible, and it's all, everyone's talking, is the consultation online or is that in person?
Yep. So at the moment we are solely telehealth. So we do envisage that one day down the line we'll have a big bright orange clinic somewhere. But I think for us, whilst we have the luxury of handling these consultations online, I think, as we've all experienced post-COVID, there's not necessarily the need to go and have these physical consultations. So everything's all virtual. And once Dr. Sinovich would have outlined the treatment plan, it would be approved in an MDT meeting, which is a multidisciplinary meeting. So every prescription that Dr. Sinovich would like to write is always cross-referenced with another medical professional to make sure that they believe that it is, there's a clinical justification to prescribe medical cannabis. prescription's then sent to the pharmacy and it's delivered directly to your door. So again, it's discreet, it's safe, and it's efficient as well to make sure that regardless of where the patient is in the UK, we can get medication to them in good time.
And what is that? No, I'm sure it varies hugely from the complexity of the case, but from that first contact, so me phoning you or emailing Cantourage to then the medicine arriving at the door, what kind of timeline are we looking at?
Really depends on the capacity at the time. We'd like to think that we kind of get it turned around within 2 weeks from the point.
Oh, okay, so fast.
Yeah, and always, you know, it gets quicker. Obviously, the first time round, it has to go through a bit more checks to make sure that everyone, from a clinical perspective, is comfortable that the prescription has been written. But once you start moving to repeat prescriptions, and you know, again, if you're not adjusting your treatment plan and you've found the right medication for you in the right dose, again, it can be a little bit more, a little bit more orchestrated, and we're kind of aware what we need to plan when. So yeah, we're always trying to make sure. I think for us, you know, there's a team of dedicated professionals here. What's most important is that people get the medication as soon as possible. So that's always a top priority for us.
That's fast. I mean, that's amazing. So, and Leandra's asked, so is it so? If someone was, so she's put her question, so is it a referral from my oncology team to you guys, but you've said it's the other way around, so the patient needs to contact you. But she said the oncology team, they support integrated medicines, but in general will not refer me. It's not something we do. So it's not a case of the NHS teams referring out. It's a case of them, the patients approaching you, and then you cross-referencing with the NHS. That's how it works.
Yeah, unfortunately, it comes down to that educational piece again, as Dr. Sinovich touched on. It depends on what the medical professional says at the time, but you know, we constantly do have, I wouldn't say battles, it's the wrong terminology, but we are often kind of hitting sort of some roadblocks in getting the correct information from various different GP practices, or yeah, again, if it's teams that they're not entirely confident as prescribing medical cannabis, and particularly within oncology, it hasn't been as widely accepted as certainly where we want to get to. So self-referrals, you know, at the end of the day, if you feel that's a treatment pathway that you would like to go down, it's a personal decision, and we can certainly make sure that we pull all the correct information to get you through those eligibility texts to start treatment. And as Dr. Sinovich also mentioned, we have communication with every single other medical professional that's involved in the treatment of an individual. By law, we have to update GP practices. By law, we have to update anyone who would be involved in a treatment pathway. Because again, we need to make sure that everyone is aware on what treatment is being, what treatment is taking place, to make sure that there is the awareness. You know, we want to make sure that there's no contraindications that would interfere with treatment at all.
So Leandra, I hope that makes sense in terms of trying which way around you go about that. So and as Gabriel just alluded, it's a quick process, it's thorough, it's evidence-based, it's cross-reference, it's safe. So I think it's a great thing to consider. Another good question, Dr. Sinovich, if I'm okay to pull you back in. Cannabis is considered a sleepy drug. How does it boost energy? What's the situation there?
Now, again, as I mentioned, it depends what concentration of CBD to THC that you're going to go on. All right. And also, if you have a look at a cannabis plant, they come in different forms. Okay. Remember that the terpene flavonoid profile also play a very pivotal role within the cannabis. As I mentioned, there's so much research going in, but the terpene flavonoid profile within a flower also contribute to what type of flower that you're going to be receiving. All right. There are some terpene flavonoids that are a little more sedative. So a lot of people like using it late afternoons, early evenings. They're a little more relaxing. They help you calm, get to sleep. And there are also some flowers that the terpene flavonoid profile are a little more uplifting. All right. Where it keeps you a little more alert. You're still able to function, gets control of your pain. That's the reason why cannabis is quite complicated. And that's the reason why you undergo all these consultations, because you then understand how the flower works, what type of flower to use, what type of day, what type of oil to use when. So we try and keep it as simple as possible, but it isn't like 1 + 1 = 2. There are a lot of very different elements that we try and tailor make to your treatment in terms of what type of work you do. Do you drive for a living? What type of, are you doing a lot of night work shifts? So it's about finding the right medication to suit you, working within the realms of cannabis and what it can offer, but finding the best delivery system of improving your pain, your sleep, and your mood.
Okay, so that's a great answer there. So it's not that it's sleepy or energizing. It depends upon how you're using it and the type you're using. And this is a $1 million question. And probably back to you, Gabriel, for this one. Kate has said, obviously it varies massively. So that's the first caveat. But what kind of cost associations are we looking at here in terms of medical cannabis, but I suppose also the consultation process? What are we kind of looking at?
Yeah, it's a crucial factor and something that we're always constantly evaluating how we can make this treatment most accessible. I think that's a real key thing, and probably one of the reasons that we haven't seen the uptake here in the UK, because of course there is a barrier to entry, and we appreciate with the cost of living going up, every penny does help. And it sounds terrible to coin Tesco's line there, but but I think for us, we try to make it as accessible as possible, I said. So our initial consultations with the specialist are £99. So we as a service do subsidise the cost for patients. We understand that initial barrier to entry is something that we do our very best to make sure that we can help them overcome. And then ongoing treatment, follow-up consultations cost £49 at Cantourage Clinic. So again, it really just depends on how stable the patient is. So we always like to make sure that in the initial sense that you are having regular checkups with a specialist such as Dr. Sinovich, but as soon as the patient is comfortable, and more importantly, the specialist are comfortable with where they're at, and they can kind of map out a treatment plan, we can quite often get to a situation where our specialists would write certain things in their clinical file to say that they can adjust X amount of time without having to see me, to make sure that we're making, the cost from the consultations is kept to a minimum. And the cost of the medication, again, it depends what type of medication you're taking, what kind of dose is most suitable. But I think on average, you'd probably be looking at anywhere between £200 to £300 a month, looking at kind of a cost. But again, it could be cheaper and it could be more. It really is very, very dependent on the individual themselves. What are they looking to treat? But there's always more and more options that are coming out. And really it just depends about how can we fit it into the individual's lifestyle, because we don't want to put in a situation where it's a sticky situation for anyone, but we'll do our very best to match out. And I think the key thing is always just we're transparent on what the cost would be, and if there's anything in particular from our patients, it's always very convenient for them to clearly communicate to Dr. Sinovich what is affordable, and he can make the educated decision to make sure that we can find something that would have the desired effect, but also be affordable, because that's key.
Yeah. Well, thank you. I know, as Kate just said, it's always difficult talking about the cost involved, but I think it's a question. I think there's going to be a lot of interest in this in the membership, because I know a lot of people will benefit from it. So it's good that people have a ballpark idea of what it's going to be. But I think England in many ways is cursed because the NHS because it's always been so amazing, and because healthcare has always been free. I think there's that, and often that barrier with paying for healthcare, but that's changing, isn't it? And I feel, sometimes if you look at what people spend money on, people can spend £200-300 a month on things that are pretty, sometimes not essential. And the ability to transfer that across to something like healthcare, I think, is obviously a very good decision. And I just you guys go for another few minutes. I know you're busy. Dr. Sinovich, you okay for a little bit longer? 5 minutes?
But alluding there as well, the nice thing, look, I've worked at different clinics, and Cantourage is one of the clinics that does seem to bear costs in mind for patients, which I think is very important. Their range of products that they have start from the lower range to the upper range, which you're not going to get in a lot of clinics itself. A lot of the other clinics have very tailor-made products that they have, where Cantourage does give you that option, which I like as a prescriber, because you can almost tailor-make a treatment plan according to their budget as well, because you've got a lot of patients that aren't working that they want to access medicinal cannabis itself. And it's about making that affordability something that can work. And Cantourage is one of the clinics like no other that does seem to make that barrier, because they've got such a wide formula that they have in that you can prescribe across, which is fantastic for me as a prescriber and for a patient as well. So it's about then trying to access what works, what doesn't work, and what you can do within your range. Because at the end of the day, you don't want medicinal cannabis to make anyone bankrupt, because that's the whole point. When I started 4 years ago, you were looking at medicinal cannabis prescription of £600 to £900 a month that people were spending. Now it's come down to between £150 and £300. So in a short period of time, it has come down. Costs will definitely come down further, but that's what you get when you come to the clinic, because it's got such a wide access to a formula.
And I think, I've got, complete disclosure, I've got no affiliates or, conflicts of interest with Cantourage, but I know lots of people who've used it, and I've never heard a bad word about you guys. I've only ever heard gleaming reports about how professional you are, how empathetic you are, how successful you are, what you do. So,
how pretty we are.
Pardon?
How pretty we are.
How pretty you are. Well, that goes without saying, doesn't it? Right, one final question. You okay? Have you got time, Dr. Sinovich? You okay? One clinical question. So conventional medication has been increased for an individual, so opioid pain relief, since the initial medical cannabis prescription or a new drug has been introduced into the regime from the NHS. Would the individual need to inform Cantourage of this, and could this change the use or dosage of the cannabis they are on?
Now, it depends on where they're in the consultation process. So if they are initially, normally I say for all patients that start medicinal cannabis is not to alter any of your medication for a good 2 to 3 months until we get you on a stable level of medicinal cannabis, and then we can look to wean out the medication itself. Sometimes if they've been on us for a long period of time and they need other supplement treatment, look, cannabis is never going to control all your symptoms. Okay, that's not the aim of it. It's trying to augment all your other symptoms like any medication itself. But again, that's the reason why you have a constant review process. That's why we have a look at your medication. That's why we have a look at what products that you're on in terms of your concentration. So you're always constantly followed up with your consultation to find exactly what's happening. And normally when we see people, we find there's been any adjustments to the other medication. And 80 to 90% of the time, most people say that they've come down on the other medication.
Oh, wow.
A lot of research. Look, I've had patients come. If you have a look at all the research that's in terms of cancer pain. Now, there was a study that came out in 2020, I think, and that's from a New York study where it looked at oncology patients. And half of these patients reported a 50% reduction in their pain medication. It was the same study that was replicated in Thailand as well.
50%?
Yeah, so there's quite a big majority of patients that have come down on the medication itself. Look, it's about trialing different medications, small dose to see what works, but it's about how we can improve one's life. Look, there's loads of studies that are going to come out in the next couple of years. It's just the tip of the iceberg, and it's about where we move forward now as individuals and what you want to do at the end of the day.
Okay. One very final question. Anyone that is a blanket contraindication, non-eligibility for using cannabis, is that main kind of barriers?
Oh, barriers, while there are a lot of relative contraindication, there aren't absolute indication. That's the reason why that you have assessment. So if you look at the relative contraindications, those people with any type of unstable heart or lung disease, the reason why is because THC can cause a bit of tachycardia, drop your blood pressure. So we look at that, the reason you undergo assessment. The also history of if you are planning to become pregnant, because there's not a lot of research trials around that. Psychiatric history sometimes can play a role, looking at if they do have any history of psychosis. But again, that's a relative contraindication. That's the reason why you undergo an assessment to see exactly where it's coming about, how is this all coming about. Most of these psychoses that are reported with cannabis are individuals that have been smoking excessive amounts, all right? Mm-hmm. And when they're smoking in the black market, number one, they're not sure what product they're getting. They've been smoking it, so 80% of it is being used up, generic products. So they're using it in the wrong system as well. I've had people that have been smoking cannabis come to me. We've reduced their usage by half to a third in terms of coming across to the medicinal reason. And then also looking at the current medication that they're on, that could be on a lot of sedative medication. So those things you have to take into play. That's the reason why you have a consult. That's the reason you don't just phone up and say, pharmacy, I want this, when you don't know what you get in itself. So it's about doing a holistic approach to an individual, assessing them as a whole, looking at all the various factors that potentially could interact and how we can overcome it and minimize side effects in order to get the maximal benefit in the long term.
Okay, perfect. Okay, well, I'll leave it there. I can see lots and lots of questions coming up on the Facebook. What I'll do, I will signpost those through to Cantourage, and you guys can contact the clinic, and I'll come onto the Facebook group once we finish, and I'll go through a few bits and pieces. But Dr. Sinovich, Gabriel, I'm so grateful for you giving us your time. I know you're super busy, but I think it's such an important topic. For me, it's a travesty that so many people still don't know that this is available in terms of an evidence-based prescription modality, and I think it's unacceptable that that's the case. And obviously, you guys are changing the landscape, and I think that's immense. So, thank you so much for coming on today. Super grateful. And I hope our paths cross again. And I hope we can continue to kind of move the bar forward, getting more and more people are aware and au fait with the fact that this is an option, and it's often a profound option. So massive well done on what you guys are doing. You're changing the landscape. So thank you so much, guys. Super grateful. Have a lovely rest of the day, everyone here and also on Facebook, and I will see you soon. Cheers, guys.
Thank you very much, everyone.
Thank
All
you.
the best.